Welcome back to the Next Appraisal Tool modules. This module addresses question 22. Are the study results compared with previous study results? How do these results differ and are similar to these previous studies? When answering this appraisal question, consider how well the author places their results within the context of what is already known about the topic. This existing evidence is typically described in the review of the literature section, which is the introduction section of the article, and then is revisited in the discussion section. Does the author explain how the results are consistent with or differ from the previous studies? Does the author clearly describe the new evidence that their study adds to the existing body of knowledge? Let's review this passage of an article to answer our appraisal question. O'Connor and colleagues examined associations between the presence of a daily routine and older adults' health status and urgent healthcare utilization to determine whether higher levels of daily routine mediated associations between socioeconomic position and health outcomes. You may wish to pause the recording and restart when you're ready. When formulating your response to this article, the answer is yes. The authors briefly remind the reader that the study hypothesized association between daily routine and urgent healthcare utilization was not supported, and then they clearly describe their results were consistent with the previous research about chaos and care utilization. Authors further propose a logical rationale for not finding this association to enhance the reader's understanding. Congratulations! You successfully completed this module. You may return to the main menu or continue to other appraisal modules and the next EBP course.